Good morning and welcome to Off the Mat. I'm your host, Laurie Andriacchio, and I'm here to help you create the life of your dreams in your own unique way by bringing you experts in a variety of fields who will share their inspiration, their stories, and their knowledge and help you piece what resonates with you, pick and choose, and assemble it in something spectacular. So today, helping me out here is Dr. Paulina Karmazin. Hi.
Hi,
Sure.
how are you, Lauren?
Good. How are you?
Thank you for having me here.
Thanks for joining us. So Dr. Karmazin is from South Jersey, holistic. It's a practice of integrative medicine and pain management, coming from a different perspective than you may be used to. And if you're wrestling or struggling with an acute or chronic problem, you want to stick around and hear what the doc has to say. So, tell me about you and how you're. So, Dr. Karmazin is an MD, Western med doctor. Kind of take me on your journey of what didn't quite sit well.
I'm third generation female physician in my family. I believe this is my calling. And I've had a private practice, primary care practice, family practice for over 20-some years, and always combined holistic medicine with conventional medicine. For the past 3.5 years, I'm just concentrating on holistic medicine, and I incorporate several different acupuncture, homeopathy, functional medicine, biopuncture. I have a special interest in holistic pain management. Because especially now with the opioid
crisis, or whatever you want to label it, but
it's extremely important because a lot of it starts with us physicians when we initially prescribe some strong meds, and some people just get hooked on that.
Right. Yeah, there's no protocol for a doctor to, there's no responsibility afterwards. It's getting there.
There is more control over that, but nevertheless.
And they're not necessary.
So there are healthier ways and safer ways to try. And in addition to pain management, I also do integrative medicine, and I employ functional medicine approach, which is looking at the root of the problem rather than just trying to correct the symptoms. And so when you try to find why is something happening, and try to address that, a lot of different symptoms actually go away.
Go figure, right? A lot of concentration is on a symptom and just eliminating or alleviating
the symptom. And the way we work is not suppressing the symptom, actually looking at the root cause of the problem.
And it may. You may have to go a little deeper, and especially with you combining the pain management along with looking to find the root, so you will get relief while you're looking for.
For example, a lot of people who are suffering from pain, the root could be their food sensitivities. There are some people who have sensitivities to gluten or to dairy, for example, and that in time causes inflammatory, low-grade inflammation in your body, something that's so-called leaky gut syndrome, where the lining of the gut is not totally tight, and causes inflammation. And that inflammation produces autoimmune response. And that autoimmune response then can affect our joints. There is proven evidence that, for example, rheumatoid arthritis often linked to leaky gut syndrome or to gut problems. Because your body develops the inflammation, and then it attacks the autoimmune response. It can attack your joints. It can attack your
makes sense.
Thyroid. Hashimoto's thyroiditis, for example, can be also related to food sensitivities and intolerance and dysbiosis. We have the gut has the bacteria that's supposed to help digest food. And when we take antibiotics or for other reasons, that composition of that bacteria changes.
Right.
We
And-
develop yeast and
Right.
other bacteria that's not supposed to be there. And instead of food becoming a nutrient, they don't. The food doesn't get digested properly,
Right. So
and
it
that
starts
becomes,
clogging and
exactly
attack.
becomes
Right.
a problem.
Wow. So yeah, this is going to be a good place to take a little pause, and when we come back, we're going to get into more of how exactly Dr. Karmazin treats these different things and how she can actually help you heal and be, not just be pain-free, but actually heal. So stick around. We will be right back.
Visit us at Plymouth Rock.
Hey, welcome back to Off the Mat. I'm your host, Laurie Andriacchio, and I'm here talking with Dr. Paulina Karmazin of South Jersey Holistic, it's pain management and integrative medicine. So we were talking about how you were transitioning, or not even transitioning, you've always had holistic
Right.
practice as part of your conventional practice, but now not so much with the conventional, so more holistic, and your specialty is in pain management. So if you're coming, with a chronic
Holistic
problem,
pain management.
holistic, sorry,
Right.
yes, big difference. So,
Right.
it's not just managing the pain. Can you take over and tell
Sure.
me what?
Well,
and
the reason
how you-
I studied Chinese medicine for about a year after I finished medical school, and it's always been part of my practice. I'm board certified in acupuncture as well, and the reason was because I never felt comfortable with the side effects, especially side effects of some conventional medications.
Right.
So in holistic pain management, what I utilize, I do acupuncture, biopuncture, I use homeopathic medicines and some natural products.
Can you touch on a little bit about what? Just
Of course.
just we don't have time to
So
expand totally,
acupuncture
but
is about 4,000 years old.
Right.
So it's well-proven technique. It's a tiny needles that get inserted in a specific acupuncture point on the patient's body, and depending on what we're treating, the particular points need to be
right. So what it's
addressed.
actually, some people may have, I don't want to say issue, but maybe don't understand if you just say it's moving energy around.
Well,
So-
the ancient theory is we have 14 meridians through which the energy flows.
Right.
And when that energy is blocked on a particular meridian, then when you have the symptoms or disease.
Right.
And the point of acupuncture is to reestablish that flow of energy. And of course, in a modern explanation is that by stimulating with the needle a particular acupuncture point, it stimulates the peripheral nerves that carry the message to the central nervous system, and from there it balances the organ system that you're trying to reach. So usually the treatments are about 20 to 30 minutes. Patient lays with the needles. It's really not painful.
Right.
While
Not at all.
they're
My 9-year-old son
Yeah.
does it, so.
while they're
And-
with the needles, they don't feel
Yes.
anything at all.
Yeah.
And it takes several treatments. It's never one treatment is never enough.
Well, yeah.
But I find that that's very safe. It doesn't have side effects, and it's very helpful.
And it'd be helpful in a variety
Right.
of
Right.
things. I mean, it's
exactly.
activating
it's not
nerves.
Only, by
and
the way, it's not only for pain. I use acupuncture for sleep problems, for hot flashes, for PMS, for irritable bowel syndrome, for reflux,
Right.
multiple medical problems.
Oh,
so
absolutely.
acupuncture could be used for pretty much anything and everything.
And then with that also you have biopuncture, which
Biopuncture is
you may
something-
not know what it is.
Yes,
So
biopuncture
this
is something unique. And I was lucky enough to train with Dr. Jan Kershot from Belgium, who pioneered this method. And what it is, it's injection of homeopathic medicine, which is a very safe, minute dilutions of a natural substance, into the either acupuncture points or into the trigger points.
Okay, so you're getting a double dose acupuncture and
Exactly, yeah. And it's totally amazing the way it works. You see, what do we do now when we have pain? We use anti-inflammatory medications, the Advil, the Motrin, etc. They do help with pain, but the way they work, they interrupt the natural healing process that our bodies go through when we have an injury.
Right.
In addition to that, they have some serious side effects, especially if you're taking them on a regular basis. They can affect your kidneys, your liver. It can give you an ulcer. It can give you bleeding problems.
Yeah, we're so conditioned. No one thinks, oh, it's just an Advil or an aspirin.
But it's much, much more than that, and it's actually can be very dangerous.
Right.
And I think medical community is recognizing that now.
More and more.
Exactly.
Yes.
So the way biopuncture works, it modulates that inflammatory process.
Okay.
So it doesn't interrupt the healing, but it modulates it so it's not quite as uncomfortable. And
Okay.
I find that it helps to decrease the inflammation and boost the body's immune system much quicker.
Right.
I
So-
use it a lot for pain management, but we also use that for asthma, for example. Or if you're coming down with cold or flu, if you come in like within the first day or two
Okay.
and we do biopuncture, it really shortens the duration and intensity of the
You can
the
actually do
symptoms.
something for the common
Absolutely.
cold.
And
You're
those
not
people
stuck.
who,
Yeah.
who did that and they saw the results. Now, as soon as they come down with something, they call us, they're going to come in for my biopuncture.
Right, because
So
I mean, it's going to you get stressed. You might not be sleeping the way you should be. Your body starts to kind of
Right.
lose its defense. So you virus flies by and you get it. So
Yeah.
this will help. An immune boost. So, and even if you have a chronic problem or an injury that you sprained your ankle.
Yes,
Or,
that,
yeah,
excuse
sure.
me, that works the best.
Yeah. So yeah, we are. I stock so much arnica in my house.
Yeah.
It's not even funny. The breed. I
Don't
used to
leave
think
home
there was
without it. Yes.
absolutely not. My daughter's backpack for volleyball.
Great.
Arnica's in there. She's got a whole little homeopathic first aid kit.
Right, yeah.
And
Well, some people
when
may
she's
not know what homeopathy is all about. And
So yeah, we're going to pause here, and when we come back, we're going to learn about a little more of what homeopathy is about, because you really need to know this. If you don't, we'll be right back.
.com.
Welcome back to Off the Mat. I'm your host, Laurie Andriacchio, and I am so grateful to have here with me Dr. Karmazin. Hello again. So this is pretty interesting. So we left to take a break, and Dr. Karmazin had a little tickle in her throat that she was kind of struggling with during the last segment, and she went off to tap into her homeopathic little first aid kit. And what did you take?
I just, I have postnasal drip like everybody else in New Jersey, and of course it kicks in when in the most inopportune time. So I took something that's called Hydrastis, and usually like within 10 minutes, it helps.
And we're going to observe that. So how does homeopathic remedies,
Right.
how do they
Well,
work?
first of all, what is homeopathy?
Yeah.
Homeopathy is it's about 200 years old, and Dr. Samuel Hahnemann is the father of homeopathy. It's a treatment with a minute dilution of a natural substance. So it could be a plant, a mineral, or biological substance, but diluted to infinitesimal degree. So because it's so diluted, number one, it's very safe.
Right.
And number two, the way it works, it triggers your body to fix itself, which is much more physiologic than trying to suppress the symptom,
Right.
which unfortunately a lot of conventional medicines do.
Right.
You
Yeah,
know,
like you have an antihistamine to
Exactly.
treat instead of the
Yeah.
histamine that you would treat.
Yes, and help your body fix it from within.
Right.
That's the main principle.
Right.
You know, in homeopathy, like treats like. So, for example, if you cannot fall asleep at
Right.
night, or you go to bed and your mind is spinning, you know, one of the great medicines for that is
Whiskey?
coffee
No,
accrued.
sorry.
That works too. Coffee accrued is a minute dilution of, it's homeopathic coffee.
Okay.
So in homeopathy, also it's very important, the modalities, what makes you feel better, what makes you feel worse. For example, if a person has hives, you know,
Right.
if we, in regular medicine, we use Benadryl
Right.
for everybody. In homeopathy, if your hives are better with cold compress and somebody else's hives are better with hot compress,
Right.
it's two different medicines.
Right.
So because of that, those consultations, when patients come in, the consultation can last about 2 hours or so, because it's very important for me to get to very particulars of the person. In in
Yeah, when's the last-
integrative medicine, in homeopathy, we don't treat the disease.
Right.
We treat a person who happens to have a particular complex of symptoms or
Right.
problems, and we treat that person.
Right. Well, what
So
a
it's
novel
very-
concept too.
Yeah, so
And you
it's
actually
very-
talk and get to know what's going on
Yeah, there was a
mentally.
questionnaire the patients
physically.
need to fill out prior to the appointment, where I spent time to actually study that before they come in.
Right.
And even with that, the whole appointment sometimes lasts up to 2 hours. So,
Right. When's the last
it's-
time you
it's really a
spent that much
partnership,
time with your
exactly. So
physician?
it's
Right.
really a partnership between the patient
Right.
and me, and then we come up with a plan of treatment. And
Right.
a lot of times I combine acupuncture and homeopathy and nutritional counseling and biopuncture, depending on what the person's problems are.
Right. And then
And-
they have to be willing to participate as well.
Exactly.
So-
Otherwise, it doesn't work. It's not like here's your prescription, come back
Right.
in 3 months. That does not.
Because that doesn't work either. So,
No, and we spend a lot of time also talking about the lifestyle,
right.
the nutrition, what patients eat, and then a lot of times I find that there's certain foods that patients may not even realize that they're sensitive to, which is a culprit.
Right. I had a friend that I was talking to, and she was eating certain things, and her lemon water, banana, like everything that she was doing, she didn't realize she was adding to the inflammation that she was currently.
Exactly.
But she thought it was healthy because that's what she usually did, and
Right.
But she had something going on where every part of her routine, the banana was clogging, the apple cider vinegar was exacerbating the condition, and then she talked to somebody about like, oh, okay, this
Yeah.
isn't good for me right now.
And it's amazing
So
how you see if I find this is the most difficult part for the patients, to change their lifestyle.
Yes.
You got used to your foods, and but if you have a proper positive approach to that,
Right.
it works.
Right.
It's amazing to see how people amaze themselves.
Yeah.
I can't believe I'm feeling better.
Exactly. And instead of looking at
Yeah.
how limited you are,
Right.
because usually it's not as limiting as you think it is.
Absolutely not.
You
Yeah.
still have a variety to pick
But
from.
you see, I find that the trick is to concentrate not on what can I not have,
Exactly.
but okay, what is out there that I can have.
Right.
And that's much more positive approach.
Right. And a lot of it could be temporary as well. Your body can get back into alignment and get back into sync. It's like a
you let
reset.
your gut heal.
Right.
You let it heal, and then you, one at a time, you can try certain foods
Right.
and see, maybe
Right.
I can tolerate that.
Yeah, you have irritable bowel syndrome or some other thing, and you're eating all kinds of really hard to process food,
Right,
meats,
yeah.
and you're drink whatever. It's just so much on your system.
Right.
Yeah.
Yeah.
Even if you're dealing with yeast,
Sure.
to overtax
Yeah,
the
well,
system.
sugars.
and
It's
sugar.
big.
Yeah.
Sugars, yeast loves sugars.
Yeah, so you're going to want it.
You're going to want it. It makes you crave it.
Yeah.
And it takes about 2 weeks to really withdraw from sugars.
Right. So yeah,
It's an addiction.
it is. It's
Yeah.
and you just have to get over that.
Right.
And look at the positive of what you are able
Once
and the
you
direction.
start feeling better and you get more
Yeah.
energy and you don't have the pains,
Right,
it's all worth it.
right, definitely.
Yeah.
So you also incorporate. I was noticing that. Can you talk a little bit about the men's, and as far
well,
as or just to touch on?
Is,
is
no,
that
when
just
I do
another?
acupuncture, for example,
Right.
we use the electrical stimulation for certain conditions. So some of the needles I attach to the little special
So it's like
acupuncture
little
stimulator.
boost
they
on your.
feel a little, yeah.
So that's kind of a cool thing too. That just you get a little
Right.
turbo boost on
Right.
your.
Well, it kind of helps with the healing process.
Right.
Yeah.
Very nice. And it's just so refreshing to the possibility that's here is amazing. And
Oh, there is no
it's
no
limitless.
limit.
Yeah.
Exactly, it's no
Absolutely.
limit. It's the unfortunate part is, of course, that unfortunately some most of the insurances
Right.
don't recognize
Right.
a lot of
Well,
things
yeah,
that we
hopefully
do,
that,
so-
I mean, is changing a bit. And if you are
let's certainly hope
struggling
so.
with something or not struggling, you want to stay in alignment, can you tell us where to find you?
Yes, right now I'm 2309 Evesham Road in Aurora Center. We do provide free information sessions for patients. So
Okay.
because we do a lot, and sometimes for people it's confusing.
Right, oh yeah.
So we offer a free 15-20 minute information session. Patients come in and I meet with them and I explain to them what I do, and then they decide whether they want to
Very nice.
come in and do that. Our website is southjerseyholistic.com.
Okay, so that's spelled out, southjerseyholistic.com.
And you're welcome to visit and see if it's something for you.
Yeah, there's a lot of information on the website, so you want to poke around there and explore a little more. But honestly, give it a try because it definitely works. I've used this approach myself with my family, and it's helped with so many things.
And even with now it's a flu season,
Right.
and there are so many things that you can do to prevent yourself from getting sick.
Okay. Do you have
Well, for example,
an
there is-
example?
yeah, Astylococcinem.
Okay.
It's a long name.
I know, I can never pronounce that.
Right.
Say that again.
Astylococcinem.
Oxalococcinum.
It's a
Okay.
French
We say that.
homeopathic medicine.
Oxalococcinum.
And the great ways to, I don't leave home without that.
Mm-hmm.
If somebody's, for example, coughing, or if you're exposed to someone at work, just a half a dose every day just for exposure
Okay.
protects you from catching it.
Okay. Go ahead. And it's at Whole Foods. It's
It's
at
Whole Foods,
I'm starting to see
vitamin shops,
homeopathic
occasionally
medicine in
some
drugstores.
pharmacies
Yeah.
have that. I never get on the plane without taking it. Do not get on the plane without taking it.
So
Yeah.
yeah, say that 3 times fast.
Astylococcinem. Yeah.
Oxalococcinum.
And also, when you start getting sick, if you think, maybe I'm getting sick, that's the time to take it. Don't wait until you get home
Okay.
because it's too late. So you start when maybe I'm getting sick, you take it 3 to 4 times a day for 3 to 4 days. It really helps to either prevent it from developing or, minimizes the symptoms.
That's wonderful. So take that advice and thank you so much.
Well, thank you
This is
for having
great.
me.
Thank you. It's a lot of information here, and it's so wonderful. Can't wait to dive a little bit more into this. And
There was a lot
yeah,
of information.
but
a
you have to
lot
come
out
back
there.
and tell us a little
I'd
bit
love to
more.
do that.
So again, look on Dr. Karmazin's website, southjerseyholistic.com, and give her a call. Stop by, and even if you're not local, give her a call, and maybe you can, have a little chat and
Sure.
see, how she can help you. I'm sure you're not too far to maybe.
We
make
have
that.
patients coming
Yeah.
from Pennsylvania and from the shore.
I would definitely drive
Yeah.
far. Take a plane. All right, so we're gonna pause here.
Okay,
And
thank you.
Again, thank you, and thank you for joining us on Off the Mat. Go out there and create the world of your dreams. Peace.